The body temperature is a critical aspect of our overall health and well-being. It helps regulate various bodily functions, including metabolism and immunity. While most people consider a body temperature of 98.6 degrees Fahrenheit, 37 degrees Celsius, as the norm, it is essential to understand that normal body temperature can vary depending on various factors such as age, gender, time of day, and even activity levels. For adults, the average body temperature is generally around 98.6 degrees Fahrenheit, 37 degrees Celsius, but it can vary slightly from person to person. Some individuals may have a slightly higher or lower normal body temperature, which is still considered within the normal range. It is worth noting that body temperature can fluctuate by about 1 degree Fahrenheit throughout the day, typically being slightly lower in the morning and higher in the evening. In infants and newborns, the normal body temperature is slightly higher than in adults. A healthy baby usually has a body temperature between 97.9 degrees Fahrenheit, 36.6 degrees Celsius, and 100.4 degrees Fahrenheit, 38 degrees Celsius. It is crucial to monitor a baby's body temperature carefully, especially if they appear unwell or exhibit other concerning symptoms. Pregnancy can also impact body temperature. During pregnancy, hormonal changes can lead to a slightly higher baseline body temperature. Additionally, pregnant women may experience hot flashes or increased body heat due to the increased metabolism and blood flow associated with pregnancy. However, it is essential to distinguish between these temporary fluctuations and the presence of a fever. Fevers occur when the body's temperature rises abnormally in response to an infection or illness. In adults, a fever is typically considered a body temperature above 100.4 degrees Fahrenheit, 38 degrees Celsius. In babies and infants, a fever is often defined as a body temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher. Fevers are a sign that the body is fighting off an infection, and they can be accompanied by other symptoms like chills, sweating, body aches, and fatigue. It is important to monitor fevers closely, especially in young children, and seek medical attention if they persist or worsen. It is also worth noting that factors like physical activity, environmental conditions, and certain medications can affect body temperature. For example, engaging in vigorous exercise or being in a hot environment can cause a temporary increase in body temperature. Certain medications, such as those used to treat thyroid disorders, can also influence body temperature regulation. To measure body temperature accurately, different methods can be used. The most commonly known method is the use of a thermometer under the tongue or in the armpit. However, there are other options available, such as forehead thermometers and ear thermometers, which provide a quicker reading. It is essential to follow the instructions provided with each thermometer to ensure accurate measurements. In conclusion, normal body temperature can vary among individuals and depend on factors such as age, gender, and time of day. While the average body temperature for adults is around 98.6 degrees Fahrenheit, 37 degrees Celsius, it is normal to have slight variations. Babies tend to have slightly higher body temperatures, while pregnancy can cause temporary increases. Fevers, which indicate illness or infection, are considered temperatures above 100.4 degrees Fahrenheit, 38 degrees Celsius, for adults and infants. It is important to monitor body temperature, especially in babies and young children, and seek medical advice if concerning symptoms or persistent fevers occur.